When I was 10, that's when I got my kidney transplant. When the kidney transplant was done, I would go back to Laredo and live my life, and then every 6 weeks I would have to come so they can check my stitches and check how I'm doing. After that, I started feeling more energetic.
I was grateful enough to actually get this liver and get transplanted, and you owe it to the person to take care of it, because it's truly the best gift you're ever going to receive. I mean, you've been given the gift of life. We need to cherish that.
It's important after transplantation to follow the physician's recommendations and take your medications correctly and daily as prescribed. These organs can last for decades, but if you veer from that prescribed plan, these organs can be lost. And unfortunately, the reality is we do lose many organs in our children, and the most common reason is non-compliance.
We want to make sure that they're taking the anti-rejection medication, because otherwise that can lead to organ rejection, and sometimes you cannot salvage the organ, and then the choice would be either a retransplantation, or unfortunately sometimes you don't make it to a retransplantation in a timely fashion. So taking the medication, showing up to follow-up visits, making sure that we obtain all the testing that we need is very important for us.
Having a daily routine, taking it the same way. Like, I take mine 6:30 in the morning and in the evening, and that's just critical because your body needs to, it's already adjusting to the medication. You don't want to throw it off more by changing it up every day. It's just the medication won't be effective. So, and it can lead to failure and rejection, and why would you want to go through that again? You just wasted an organ.
It's very important that they keep their appointments. It's very important that they react to symptoms so that they don't come late for evaluation. Whether it's infection or rejection, best outcome will be if we treat them on time.
What families can expect, the whole process from beginning, when they first get here, they go to the registration. And once they're registered, they come to our waiting room. Once they are there, then we know they're here. Our medical assistant will go and get them, and she'll start doing the vitals on them. She'll place them in one of the rooms, and that's when we go in and do the blood work.
Blood draw tells us a lot about what the kidney is doing, what the child is doing, what the medications are doing. There's a multitude of information that we get from blood work. That's why it's so important for patients to get it at the time that it's needed. Other testing that the patients get post-transplant is going to be DEXA scans, ultrasound, and echocardiograms. A lot of it is ultrasounds.
After transplant, you have to keep up with your appointments, you have to come to lab checks, you got to make sure that he's not having any type of rejection. I also know that his immune system, it's still a little bit down. It is worth it because I see that his quality of life, it's a whole lot better, even though it requires maintenance.
This is a photo of my surgical scar from my first liver transplant. When my second transplant came along with all of the other procedures and doctor's visits and everything being in and out of the hospital constantly, I thought to myself, maybe I could do some good for others who are going through the same thing that I'm going through right now. And so that's what inspired me to go in the direction of nursing. And now I am working as a registered nurse on the transplant unit here at University Hospital. I see these kids and I tell them, you can get through this, and you can still go on to live a good, normal life and become whatever it is you'd like to be.